iawn o weld cynrychiolaeth mor amrywiol o weithwyr gofal iechyd proffesiynol, a dwi'n falch o rannu rhai diwyddiadau allweddol gyda chi ynglyn â poen parhaus yng Nghymru. So thanks very much for the invitation to come and speak to you this afternoon. I think this is the first persistent pain conference for Wales. Well, it sounds like you've had a really interesting morning and you've all been really busy, and that's the way to do it, isn't it? To make sure that you're engaged and you're involved, because there's a lot for us to learn. There's a lot we've already done, but there's clearly a long way to go as well. I'm really delighted to see such a varied representation of healthcare professionals here today. And I'm happy to have this opportunity to share with you some key updates in relation to persistent pain in Wales. First of all, I want to thank the organising team for inviting me. Diolch yn fawr. I think it looks, certainly your programme looks amazing. I'm a bit frustrated that I can't stay, I'm afraid, but we've got a really important cabinet meeting this afternoon, which is all about money. And I'm going to go and make some pretty important interventions, I hope. So I hope you'll forgive me and understand why it's important for me to be there. September marks Pain Awareness Month, and today represents a valuable opportunity to raise awareness of an often unrecognised aspect of pain, which is, of course, persistent and chronic pain. And what we know is that this condition affects a significant proportion of our population. I think that's estimated between 33 and 50% of the population suffer with some form of persistent pain. And that's up to 1.3 million adults just in Wales. So we are talking about a lot of people here. And these are conditions that can have a major impact on a person's quality of life, their ability to work, to function, as well as clearly their mental well-being. But we know that with the right information and support collectively, we can develop pain services in a way that produces better outcomes and experiences for these individuals. And that's why the Welsh Government has been working closely with our partners in the health service, academia, and those with lived experience to refresh the Living with Persistent Pain guidance. Now, this was first published in 2019, and we've received positive feedback, I think it's fair to say, on its use as a source that empowers individuals to better understand their condition and to become a more active partner in their own care, and as a tool to aid health boards to plan their persistent pain services appropriately. Now, it's important that this guidance continues to evolve as we gain more understanding of what works and where there's scope for improvement, based not just on evidence, but on talking to people about their actual needs. And we know that since 2019, a huge amount has changed. COVID has led to significant developments in how our NHS services are developed and used, including how we can develop and take full advantage of digital technologies to improve access and outcomes for the people that require care. And it was great to see recently an example in Hywel Health Board, watching people prepare for surgery, all done remotely. And the feedback from the patients was that this is really, really working for them. It's preparing them for operations. It did reduce their pain. It was all of these things. So this ability now for us to use this remote access, I think, is absolutely transformative. So I'm really pleased that the refreshed guidance being launched today has been written to reflect those changes and to recommend actions for health boards across Wales in a more clear and measurable way to help us build on the development of persistent pain services. Now, the aims set out in this document very much align with our national strategies for a healthier Wales, the Welsh Government's programme for government, and the principles set out in the Wellbeing of Future Generations Act, by putting a focus on prevention and helping people to stay active and independent, and really importantly, empowering people to do more to manage their own conditions.